Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast, as part of the Howl and Shiztorm. This audio podcast as part of the Ship Mode and Atom. This audio podcast as part of the Mayhem Squad. This audio podcast as part of a Storm Robotics production. Through this audio podcast, looking into or delving into the pathophysiology or more into the pathophysiology, and looking at Crohn's and around Crohn's disease, and where this works is in around some works that was done by pharmacology and science students within an academic institution in the Midlands, and where it was a science student, C. Jefferson, a pharmacology student, C. Jefferson, with additional colleagues or different additional students who actually drafted or articulated a well informed a document in around Crohn's. So in around sort of continuing into the pathophysiology. So Crohn's disease can be caused by genetic, but also by and through infectious or immunological, environmental, and sort of in around to sort of nutritional factors. The inflammatory response is caused by intestinal macrophages, neutrophils, and T helper cells, and T helper cells. The inflammation can cause fever and sickness initially, but as time goes on, the sort of the sensitive bowel area then can become more painful, and the intestinal injury worsens. So damage to the ileum, so the main component of the bowel, or leading that sort of part of the pathophysiology leading into the bowel. The damage to the ileum can cause vitamin sort of deficiencies, and also prompt anemia, which can occur because of poor or abnormal or anomaly in vitamin B12 absorption, or blood loss in the feces. Genome studies or genome investigations, and in amongst published works, have found that there are 71 loci on 17 sort of chromosomes that are linked with the susceptibility for Crohn's disease. Environmentally, reports have shown or informed that there are higher incidents of Crohn's in rural or peri-urban regions. However, this has been argued due to, or debated due to, the occurrences of adverse life events, and less women, less females also breastfeeding, and also a sedentary lifestyle, and additionally increased hygiene and exposure to air pollution. Additionally, the inflammatory bowel disease, or the inflammatory bowel aspects of Crohn's is caused by CD4 and CD8 T cells, B cells, and CD14 monocytes, and natural killer cells, or NK cells, infiltrating the gastrointestinal tract or GI tract of patients, and mutations in the MUC2 gene, responsible for the mucus production, allowing immune cells to enter the gut, can cause or are prompted to cause further inflammation. T cells are then the main cause of the intestinal inflammation, but B cells are just as important because they are specifically those that secrete granzyme they specifically cause or secrete particular enzymes particular enzymes, and one specifically is granzyme B, which is an enzyme that kills intestinal mucosa mucosa cells or tissue cells and within the intestinal tract, and prolong the damage to the intestinal epithelium. And so inflammation occurs. Inflammation also occurs anywhere in the gastrointestinal tract, from starting from the mouth, since the intestinal tract isn't just isn't just that part of the gastrointestinal tract, but also all the way starting from where the epiglottis is, from the base of the mouth, or where the epiglottis is, and all the way to the gastrointestinal tract itself. So inflammation can occur from anywhere from where the epiglottis is, all the way to the gastrointestinal tract itself, and all the way to the anus, but is most common in the terminal ileum, located at the end of the small intestine, attaching to the start of the large intestine. And lesions can begin in the invaginations of the epithelial lining, which are referred to intestinal crypts, and develop into ulcers on the superficial mucosa, and deeper lesions result in scarring, and as per mentioned, where there can be sort of fistulas or occlusions, where there can be sort of narrowings, for example, which after repeated occurrences can also lead to where there can be bowel obstruction. And fistulas in this context can form when inflammation spreads to adjacent organs, such as the bladder, the stomach, the skin, and even amongst organs such as in around the genitalia as well. So that draws this audio podcast to a close. This audio podcast as part of the Howl and Shitstorm. This audio podcast as part of the Shit Mode and Atom. This audio podcast as part of the Mayhem Squad. This audio podcast as part of a Storm Lobostics production.